So what we're looking for here is an innovative approach, if possible, to ascertaining what is the effect of this medicine in its clinical use. We're not just interested in whether they can describe what has happened well, but can they actually, from the information that they are studying, derive something that will tell us that the benefits and harms of these medicines are in a very favourable balance towards the benefit. I would say that every effective medicine has unwanted effects, usually adverse. And we need to be sure that the benefits notably outweigh the harms. That will vary according to the medicine. So when somebody is putting in for this prize, we want to see that they are going to be able to find whether there is benefit and whether there is harm, that they actually don't just go through the hoops, but they actually show that if there is a problem, they will detect it. If there is a benefit, they will detect it. So we're looking for somebody who has thought through that process carefully. We hope that also they will be critical of their data. These data are observations. It's quite often difficult to draw strong conclusions from that. But by having good designs in their observational study, they will be able to draw better conclusions. So we're looking for really good designs that enable you to draw useful conclusions. And in the regulatory world, there is a buzzword of decision-relevant evidence. And what one is looking for, even here, is something that will enable you to decide whether there is something going on, beneficial or harmful, and the ability to say, having perhaps been critical of your data, what would we do better when we do it again? Because we're going to have more and more of these post-authorization safety studies and efficacy studies coming demanded by the regulators. So doing them well and not trying to pretend and gloss over any problems with the data. It isn't good enough to just have a nice marketing hype to your data, but to be able to show that you have been critically thinking about the real issues involved.